Good evening, everyone. Welcome back to Jacquah Health Radio, Jacquah Health Show this evening. We thank you all for joining us. We thank you for staying with us from 5:30 until now. Our listeners, you do so well to join us. You're patient with us with a family session of it. And now is the health show, which is the health session of today's program. We thank you very much for joining us. This evening, we have with us Dr. Deepak Ravindran. He works at the Royal Berkshire, and he is the lead doctor there in the clinical. He's a clinical lead there in the Berkshire Long COVID department. But he's also specialized in pain management. So his main role is pain management. Am I right, doctor?
Absolutely, you're right. Yes. The long COVID is an opportunity which I got to help set up and do from December 2020. But prior to that, I'm the lead for the pain management department.
For the pain management department. To be honest with you, our listeners, most of us do have problems with pain, like chronic pains and all that. So this is an opportunity to introduce you to our program, and we believe and we hope that this will not be the last time you come on. We believe that even after this session, we will plan again, and then you can join us and really help our listeners. And they have so many questions. Even after posting the flyers round, we got feedback already. So we know that this session this evening, you're going to have a lot of questions to tackle, mainly to do with COVID, and sometimes go overboard, and they can come up with their personal problems as well. So you bear with us, because we know our listeners. We know how our listeners take in information. So we are happy to have you on the show this evening. Thank you very much for coming once again.
Thank you so much, Jessica and Kofi, and all of you at Jacquah Health for inviting me as a consultant from the Royal Berkshire to be part of the community and to offer any support and advice that I can to your community here. So thank you for having me this evening.
Thank you. And one last thing before we leave it to Doctor to start. Doctor is actually working with the Reading Borough Council as well, and the other medical community to help the community. So if anybody has any question, if anybody has any issue at all regarding COVID vaccination, whatever it is, we believe that after the program, Doctor will put on the screen, as all we do all the time, how you can get in contact with him, and then he will be able to direct you to the right department. If not, his department himself dealing with that, with your issue. So we thank you again. We just want to remind listeners of our numbers, because we know some of you do have it, especially radio listeners. You do WhatsApp your questions through, but we'll remind you again, it's 079-048-62964 or 079-031-33842. So we have this evening Dr. Deepak Ravindran. He's here as a consultant in pain medicine. So he has a lot of information as well concerning the COVID pain, the long COVID pains and symptoms. Some of us are having it. We don't really know we are having it. The problem is when COVID started, when it was hyped, during that time, some of us were feeling sick. We could tell we are having symptoms here and there. So until we do antibody screening, we wouldn't know whether we've actually gotten we've been infected before. But we're still moving on. Sometimes we do get pains here and there. We don't know where the pains are coming from, how we can manage the pain. So we are very happy to have you on the program today. We will just want to start. What is long COVID? It's been on the news everywhere, long COVID, long COVID. But we want you to take your time and explain to us what long COVID is, and then maybe that will be the start of the conversation this evening with us.
Communities that I had shown and talked about long COVID. So if it is okay with the community, good evening to all of you. Thank you for giving the time this Sunday evening to come and be on the show and to come and listen to me. So I'm going to probably spend the next 15-20 minutes of my time talking to you and explaining to you about the condition called long COVID, and as well as the service that we have at the Royal Berkshire Hospital for the community, for all of you, and for your GPs. So this is an information presentation about. I'll just share my screen. So let me know, Jessica, when you tell me when you can see the presentation. Okay.
Okay.
Brilliant. Okay. So I'm just going to share this window. Let me know when you can see it.
Okay.
Yeah, we can see the screen. We
Okay.
can see the screen.
We can see the
It
screen.
needs to pick right.
And you can see it now?
We can see it now. Almost there. Yes.
Good.
Almost
So you can
there.
see the presentation as well. So this is what I want to talk to all of you this evening. So thank you for that. And I'm going to be talking about the problems that are affecting people after they have had a acute episode of COVID. It is called long COVID popularly, but the official term for it is post-COVID syndrome. And I will explain to you what syndrome means and why we are calling it that. So as you can see here, I'm the lead for the long COVID service. But before I did that, as I was explaining, I was also the lead for the Department of Pain Medicine. I'm an anesthetist by background. So I see patients when they have been put on the wait list for surgery in order for giving them the anesthesia. Can you hear me?
I can hear you.
Brilliant. Okay, then that's all. It's all right for me to carry on, isn't it?
Yeah, that your slide is blank, so we don't know if we are not able to.
I have
get
a
the
slide
audio.
on, which is the main presentation slide. Is the
You have it on,
presentation mode not coming through? Is it?
No, it's not coming through.
Yes.
Okay, so can you see this now?
No.
So you
So
can't
it's-
see the slides at all, is it?
It's picked up a screen, but it's playing
Okay, let me see if I can start again.
again. Yeah.
Right. Anyway, I think that's why I did a good thing of sending the presentation to Kofi. So in case it doesn't work through, one more time I'll try. If it doesn't work through, then we know what
Then
to
he
do.
can share from here. All right. Okay.
Okay, brilliant. Okay, so now let me see. Can you see this now?
Yeah.
Yes, it
Yeah,
looks like
yeah.
yes, we can see it now.
Good. And I'm
Thank
going to
you.
just change to the slideshow mode. Can you see the
Okay.
slideshow mode?
Yes.
Yeah, so you can see the first slide that says long COVID, post-COVID problems.
Yes, we can see that. Yes.
Fantastic. All right, then. Excellent. So after the usual IT glitch, we shall continue on. So as I said,
Thank you.
I'm an anesthetist by background, and I have been paying almost years now to this book as about that just got released about a few months ago. However,
Okay.
at the end of last year, I caught COVID. I got a very bad
Okay.
episode of COVID, Jessica, and I think March last year I struggled as well for about 2 weeks. It was quite intense. It was the worst kind of viral infection that I had, and it took another 1 or 2 weeks for me to get better, and I then improved and became almost normal. But that's when I started to realize that there were a lot of us, my healthcare colleagues, other nurses, other people I worked with, who were falling ill, who were recovering, and then they were never getting fully better. And when I looked in the literature, it looked like up to 25% of people were having symptoms that were going for longer than 4 weeks or 6 weeks. And that is where I started looking into a little bit more into this problem called long COVID. And at that time, in social media, in Facebook, in YouTube, as well as everywhere throughout the world, patients were starting to come together to say and ask what was happening. Why are we all still struggling with so many symptoms after having had COVID, many months ago? So that's when we realized that we had this problem called long COVID, and we were able to help set up a service and got everything together. And even now, the UK, as far as I understand, is the first country in the world to actually do a very good, proper job with the help of the NHS to set up a integrated service and make some recommendations on how it should be done, who it should be done by. So, what is the data? What we now know is that COVID is almost very different to many other viral conditions or other diseases that we are aware of within medicine. We are going to probably have many textbooks written about it for the next 20 to 40 years. What we understand is that 1 in 5 people testing, that is 1 out of every 5, 20% of people who have COVID, their symptoms are going to be more than 5 weeks or long. It is not going to
Okay.
finish in 1 week or 10 days. And there is a group of people, almost 1 in 10 of them, will have symptoms beyond 3 months. So this is something that is we are realizing is a little bit more common. And by the time we set up the service in December last year, we realized that almost 40% of people who were fully in full-time occupation, they had to reduce their work hours and were not able to be as productive because of struggling with long COVID. In fact, 22% were not even able to go back to work. That was the kind of data that we were starting to see in the papers. And just to put it in perspective, this is as of January. These figures are a little old, and these were before the sort of weekly till January, but this is up to the end of March. So almost when the second wave was starting to come down, we had almost 4.4 million cases in the UK who were positive for COVID. And what are we thinking about? Locally, when we looked in Berkshire and say after wave 1 and wave 2, we had this new data that came in April. Just last month, they said that finally 1.1 million people in the UK are struggling with long COVID, meaning that they are having symptoms of that is lasting beyond 4 weeks, and 1.1 million are possibly there in the UK. When we thought about how many are there in Berkshire, we thinking that possibly conservatively 3,000 to 4,000 people in Berkshire alone are possibly having long COVID. That's the numbers we are thinking people having there. So it is quite a lot. Now, you asked me, what is long COVID? What our present understanding of long COVID is that it is possible that there are 3-4 groups of people who are all going to be having this condition. One group of people are those people who really struggled. They were very, very severely unwell. They were in hospital. They, in fact, were in ICU and had organ problems. There is another group of people who would have been in hospital, not in ICU, but would have had breathing difficulties or liver or lung problems. So they have organ complications. Then there is a group of people who, after viral infections, can have symptoms for many months. We always knew that any virus can sometimes affect the immune system and the nervous system, and people can feel tired for quite a long time. But the last group, that group where I've written their fluctuating symptoms, that is the biggest group of people that is coming to a service, because it seems to be that they are having symptoms affecting their heart, their lungs, their breathing, their intestine, their brain, and it seems to be changing. Some days they feel good in their breathing, other days their heart is beating too fast, some days they're eating very well, other days they have no appetite and are losing weight, some days they are able to think clearly, other days they are very forgetful and they don't know where they've left their car keys. So this is all a fluctuating symptom pattern, but commonly, irrespective of which group of people they are all reporting fatigue, they are reporting pain, they are having shortness of breath, they are having concentration problems and memory issues, they are having new anxiety or depression like mood changes, they are having fast heartbeat or rapid heartbeat or palpitations, and they are sometimes having stomach upset. Either they are feeling too sick, or they're having diarrhea or constipation. So this is all changing in that is there. So long COVID is when you are having symptoms for more than 4 weeks after an acute COVID, and you have any of these symptoms, and your blood tests are not showing anything abnormal, most of the tests are normal, then we are thinking that this can be called as long COVID. Now, you might be asking, and your listeners or viewers on YouTube or Facebook might saying, why is this happening? What is the problem? And right now, just to keep it simple, we can go into this as deep as you want. But right now, to keep it simple, what we are thinking is that the immune system and the nervous system is hyperactive. After having the first attack or encounter with the virus, they are still in a very elevated state of hypervigilance. They are constantly on the lookout. So that hyperactivity is likely to be the most common reason. But they are also finding suggestion that there may be some virus particles still present within some parts of the brain or some parts of the intestine that are still active. And then every time the immune system recognizes those viral fragments, it starts another episode or attack. So that might explain why some people are feeling better, then they have a relapse, feeling better, and then they have a relapse. Or it might be that if you've been in ICU or you've been in hospital, you might have been resting for 2-3 weeks. You might have been so tired that you're almost deconditioned. You're not able to do much. Your muscles have become smaller in size. So that muscle inactivity is causing deconditioning there. Obviously, we don't know whether people are having, they might have had financial issues, they might have had furlough issues, they might have been away from their family. So that kind of stress and anxiety, is it making things worse? So the bottom line is there are these 3-4 possibilities. We still need to do more research to understand. And in fact, the UK government has released almost, I think, 18 to 24 million to actually do more research into long COVID to understand why some people are getting it, why other people are doing it. But in the meantime, we want to know what to do to manage it. How can we do and help our patients? And in that, as I told you, the UK has been really very advanced in this. The NICE, which is an organization for clinical excellence in the UK, it puts out all the guidelines on how people and doctors and other healthcare professionals and GPs should look after patients. They released a guideline in December for managing long COVID. And based on that, they said that at least clinics should be set up in every part of the country. So we have got 83 national clinics for long COVID throughout the country. And there is also NHS guidance that has come out to say what should be there in the service, what kind of tests should be done, what kind of support should be given to people, what should GPs do before referring patients to the service. So all of those details have been placed in there. So based on that template, what I helped set up along with a lot of my colleagues in the Berkshire area is this Berkshire long COVID service called Bliss. We kind of thought of it as a 4-stage or at least a 3-stage model. The first stage is if you are having very mild symptoms, there are some online resources like Your COVID Recovery. It's a website. Your GP itself might have somebody in the practice to help you. And the GP itself has been suggested what kind of bloods or maybe chest X-ray or something. There is a stage 3 wherein people may be very sick with their lungs or their liver or their heart or their kidney or the brain, and they may need to go to a specialist hospital. They may need to go, for example, in Berkshire, they may need to go to Oxford or into London for more investigations and testing because they've got a specific problem there. But for everybody else in between, the stage 2 is where we have set up this service. We've got a GP who's got really good experience in managing COVID. I am there one day of the week. We've got a physiotherapist who's got special interest in breathing problems. We've got a physiotherapist who's got a special interest in fatigue and pain management. We've got an occupational therapist. We've got a psychologist for mental health issues. We've got the digital platforms for those people who are able to access things via the smartphone. But even for some people, community members who can't access internet or smartphone or not willing to do or not able to do for any reason, then we've got the paper resources and the questionnaires and all of that stuff. And we are trying to work with our local charity partners and maybe other organizations, the councils in Reading as well as in West Berkshire, to actually say, what else can we do? Once we have looked
Mhm.
after patients, what are the other treatments we can offer people for those who are struggling? So right now, the service is something that has to be referred by your GP. You can't come to it directly. You have to go to your GP so that they at least are able to do the stage one, and
Mhm.
if they feel they need our help, then they will refer to stage two. So
Right.
what we have is a referral from the GP. Then the GP will use a form, just a simple one-page form, and send it to us. We will then send the patient a questionnaire on the smartphone or via the post. It is amazing how many people have been using the smartphone. Almost, we have had 500 referrals up to now in the last 5 months. And we've been sending them by electronic, and they send it back to us on the smartphone. They fill it out and they send it back to us within 3 days. And then we are able to look at those questionnaires. And if some patient says breathlessness is their main problem, or if some people might say pain is their main problem, then we will say, okay, if pain is the main problem, they can see the pain doctor and the respiratory and the pain physiotherapist. If breathlessness is the main problem, they will see the respiratory physiotherapist. So we are tailoring the person that they are going to see based on what their symptoms are, or which is a combination of the symptoms. So once we do all that bit there, we are able to test them, make sure the testing shows that they are not having any other problems, not having any other organ or kidney or liver or lung issues. And then we are able to support them and say what all they can do to manage it. Because
Mhm.
the reality right now is that we don't have a cure for it. We don't have one injection or one drug or one tablet to take away all these symptoms that the people are experiencing. It's almost like a new long term condition. So we are having to almost learn ourselves and then teach people on how to manage the symptoms now, so that we can improve their quality of life and then get
Mm.
them back to work, or make the part times go back to full time. That's what we are
Mhm.
aiming to do. As I said, almost 500 referrals up to now. What is again something we have noticed is 28% of those referrals are still from ethnic minorities. Given that
Okay.
the census from 2011 suggested that only 15% of the population at that time in 2011 was
Mm.
ethnic minorities, we are now seeing 28% there. So whether the 2021 census will show a different number, I don't know, but this is definitely that it shows that if COVID has affected more ethnic minorities or ethnically diverse people, then long COVID also seems to be more in the ethnically diverse population, which is why one of the reasons we have decided that we need to raise the awareness amongst communities like yourself, to make sure that there is that awareness to know where to seek support and help. As I
Mhm.
told you, we looked at the first 100 people that came to our service up till March, and we found that fatigue was there in 95%. There were shortness of breath in 80%. They had concentration problems in 70%, and pain was in almost 65% of patients. They also had depression and anxiety at the same. So these were like the highest there. And the worst was employment wise, they were all impacted. These were all people who were healthy, full time work and active, and now they are not able to go back to work full time, or there is financial or emotional pressure. So we are thinking of other collaborations as well. We are trying to say for the breathing problems, if their lungs are fine and the tests are fine and the investigations are fine, we are thinking that sometimes the virus affects the nervous system, and because the nervous system controls the breathing muscles, if the nervous system is not working well, then the breathing can be affected, can be
Mm.
irregular and not in synchrony. So sometimes using a very nice technique like singing may be able to make a difference. So we are having collaboration singing. Sometimes people have loss of taste or smell, so we're doing smell training. And then we are working with other organizations in the Reading Borough Council and West Berkshire, and other charities like flotation or hydrotherapy or physiotherapy centers, to actually say, can we help something? And the Royal Berkshire charity is helping us with this. Now, in
Mm.
all of this, you might be asking or wondering, how can we prevent this? As I said, it is very difficult once COVID happens to you, we are still trying to understand which person with COVID might have long COVID or not. So what we can do at this time is to say, how can we prevent people from catching COVID? That is the question I think we have to ask, rather than saying, how can we prevent a COVID person from getting long COVID? That is very difficult problem to solve right now. The better question to ask is to look upstream and to say, how can we prevent it from happening at all? And right now, we know some things. We know that people who are having other medical problems like diabetes or hypertension or being obese, large in BMI, can be a problem. We know that ethnically diverse people are at higher risk for a variety of reasons. We know that any age group, initially we thought first wave it will be the elders, but now we know that anybody in the younger age group, if you look at India now, a lot more of the Indians are younger, 30 to 60 years of age group who seem to be getting it. With long COVID, we think it is females who are likely to get it. Again, we are seeing that the viral infection can affect there. And we know that if people are possibly having severe infection, then their chance of getting long COVID is higher. There are some social factors, and we know that if you take good care during the acute infection, there is a good chance. So these are all the things we understand up to now. But how can we prevent us from getting the COVID itself very severely? Right now, our best answer is still the vaccine. I know that we've got 3 vaccines. We are going to get a few more vaccines. People are, the UK government has invested a lot in getting new vaccines ready there. And we have a big percentage of people who will be vaccinated by the middle of this year. And I know that there is this worry around the side effects that have been reported with some of the vaccine. People are hesitant because of what they hear or see on social media. And obviously the new variants that are coming up, people worry whether the existing vaccines will look after them or not. I think this is always going to be something to think about. But from whatever the scientists are telling us now, or I am understanding from the literature, I think the vaccine is still the best chance. What I completely understand is that if you didn't have the vaccine, then, to make it easy, on the left side of the screen, you can see people may have asymptomatic infection, means people may have the virus that is rapidly multiplying in their throat, but they may not show symptoms. They may have mild disease, they may have moderate severe disease, or they may have very severe disease that they go into hospital there. And what we know is that when the vaccine is there, at least you may get asymptomatic infection, but the number of people that get the moderate and the severe disease are very, very less, no severe disease. And I think that is where I feel that our best chance is to prevent long COVID, is to actually prevent the acute COVID or make it as mild as possible. And in that, I think I will end with this to say the vaccine is our best chance right now.
Thank you very much, Doctor. Like as we have already mentioned, many of our listeners are listening via the radio, our radio channel. So they didn't see the pictures, but as you were talking, you could see me moving my head back and forth, my hand going, because the questions were coming. I had to write them down sometimes, just so I can flow asking them for them. Some of them would like to come on and ask the questions. So bear with us. But I'll just start with this question because, like I started in the introduction, I said many of us we don't even know if we've had the COVID before, but all the symptoms we probably might have experienced it sometime back, and now we are experiencing all these symptoms that you mentioned with long COVID. Somebody's asking, how can someone know he or she is suffering from long COVID if he or she has not been tested to confirm, but experiencing some of the symptoms? Obviously, now the person is testing negative with a lateral flow, but is still going through the pain. How can the person know and seek help?
It does not matter. That was the thing that the NHS central body as well realized, that when people were falling sick in January, February, or March, or even April of last year, there was no tests available for the general public. There was no testing happening at all. Antibodies or testing only happened from June or July there. So what the guidance actually said is that you don't have to have a positive antigen test. You don't have to have a positive lateral flow test. You don't have to have a positive antibody test there. If you've had an acute infection at some point during last year when testing wasn't there, and you're still struggling with any of those symptoms that I told you there, then we are still going to treat it like it is going to be long COVID. We are not going to be saying that if your antigen is negative or your antibody is negative, you can't have it. We are saying that it is possible, it is likely. What can we do to support it? Make sure we aren't missing anything serious, and then find and work with the patient, get ways to say what can they do to gradually get back to normal.
Thank you very much. Another question is, while somebody goes through long COVID, will the person still be testing positive when tested on the lateral flow or not?
No, there is. The long COVID is occurring because the virus has affected the immune system and the nervous system and has left it hyperactive. So the lateral flow test or the PCR test will only test positive if there is virus present in the nose or in the upper respiratory tract and is actively multiplying. We are not going to be getting that information at all on almost any long COVID patient at all.
Right. Who is more likely to suffer longer with the long COVID? Which group of people? Because he says 68% of females have been shown in the research to report these symptoms. Does it mean that female are more likely? And if so, is it because of our hormones? Why is that?
This is something we are noticing with generally as well, even in the chronic pain literature in research. We find that more chronic pain people are likely to be women. There is a higher presentation. Some of this is still research that is happening, and long COVID is also showing the same trend, that when the immune system is impacted, for some reason, the symptoms are much worse and shown to be more apparent in women than in men. I think we have not yet identified any receptor. It may be hormones, it may be other factors, but we are not there right now to be very sure.
Okay, thank you very much. You mentioned about BMI. If the BMI is high, it's part of the risk of having the long COVID or suffering longer. Even though you're still researching, do you know a little bit about why? We know that being obese leaves you vulnerable for so many things, so many conditions. Is it solely because of that, or is it because of something else causing the obese people to suffer more?
So this is actually a very interesting and excellent question, Jessica, that you've asked, and it's very relevant as well, because what we now understand, and when I was doing the research for my book, The Pain-Free Mindset, I had a chapter on diet and nutrition, and I written that. And what I came to understand, this is not even some information that many doctors are also aware level there. But what we realized there is that being obese, you have the issues wherein being obese can cause increased pressure on some of your joints or other things there. But what they are realizing is that when fat is stored in your body, the fat cells itself behaves like an organ. That means it releases hormones and chemicals that can only come out of a fat cell. And one of those and many of those chemicals in the fat cell are actually pro-inflammatory, meaning that they provoke inflammation. They keep sensitizing the immune system and confusing the immune system and making them think that actually there is still an infection going on. And there is this concept called TOFI, TOFI, thin on the outside, fat on the inside, which means that people may look like they are thin, they have a normal BMI, but there is often a lot of fat around the intestine and around the inside of their tummy. And most of your immune system is present inside and around your intestine. So that means that you've got all these fat cells which are releasing chemicals near where your immune system is. And so your immune system is constantly already on an alert. And then when you've got an already alert system, a virus comes in which causes some changes in that same area, your immune system just overshoots and goes completely haywire. And with
Mm-hmm.
that, I have noticed as well in the book that I've written as well, with chronic pain is much higher when you're having BMI, which is high BMI. And we've also noticed the same correlation here, that when you're probably obese, you are having a higher amount of inflammatory chemicals circulating in your body. And that puts you then at risk when COVID comes in or any infection comes in. You then become at a much higher risk of your body reacting more strongly and unnecessarily.
Thank you. Thank you very much, Doctor. I'll just put some of the comments across. We've got one of our elders who is saying that we are very grateful for you for giving us such a great message, because obviously it's something that you're living. You just said from the beginning that you had COVID and you shared your experience with us. So that made your research or whatever you were studying about it, that made it genuine. And for us in this community, we want to see and hear things like that, because then we can relate to things like that. As we're moving on, there's another question from Lucy McDonald, who is also watching via YouTube. She said, what do you think of the MCAS theory for long COVID? Have you seen results with patients yet?
So it's a very important question, and it is a question on which research is already happening now. So for many of your listeners who may not have understood what Lucy was asking in terms of MCAS.
Yeah.
So what okay. Can you hear me now?
We can hear you now. If you can just backtrack just a few seconds, then we can just grasp everything. Thank you.
Okay, good. Can I continue then?
Yes, please.
Yeah. So in the immune system, they have identified this one group of cells called mast cells. Now, all of us have lots of mast cells, and mast cells are like the first round of policemen. They are the ones who are ready for action, who are often there whenever an external army comes to fight us. They are the first policemen in our immune system to get ready. They, along with a few others, are the first people to get ready. Now, they have always found, and I think in long COVID and especially in COVID, they have found that the mast cells can release a lot of chemicals when they get activated. And in long COVID, there is a theory now that it is possibly the overactivity of the mast cells that is continuously happening. Like the mast cells haven't been told to stand down. They are like the policemen who haven't got the message that the war is over. So they are just continuing to stay there, and they are continuing to constantly have a problem there. My camera has gone off.
Yeah, we can still hear you.
Okay.
We sorting it off.
Okay, that's fine there. So yeah, and when the immune system and the mast cell stays overactive all the time, they are calling it mast cell activation syndrome. Now, in the beginning, I would have told you long COVID itself, we are thinking of it as a syndrome. Now, the word syndrome is used when you have symptoms affecting multiple organs, and they are all coming from different areas and changing over time. So that is why we think that the mast cell activation could be contributing to it. We have not yet identified very clearly what kind of drugs will be effective. And I'm reading about it, and I am in touch with a few other people who are doing some research on it. We are not yet sure what is the effect, because I've had some patients who have tried some medicines to calm the mast cells down. Some people are feeling some improvement in their symptoms. Other people are not getting much improvement. So we haven't fully understood what it is that the mast cells can do and how can we effectively control it or stabilize it? That is still a matter of research, Lucy. I hope that is right now helpful to you.
Thank you. She's actually added a follow-on question, so I will add that one to it. It says, what would you recommend for myocarditis post-COVID?
So if Lucy is asking that if this myocarditis has been identified, right now in my hospital here, I would be referring to my cardiology colleague and asking them what are the other symptoms that are happening with the heart muscle. So myocarditis is inflammation of the heart muscle, and that has been seen in a small percentage of people who are having long COVID. So if they are having symptoms like chest pain, or they are having palpitations or heart rate problems, then the cardiologist is giving advice on whether to start on any heart rate medication or starting on some medication to calm the heart muscle down. So that's what we are looking at. However, what I understand is that all the other symptoms still have to be managed in the same way. So we are still having to focus on someone with all the other symptoms. And for the myocarditis, for example, in Lucy's case, we would be asking the cardiologist to decide whether they need to do any further tablets. Right now, there isn't any need for any surgery or any other interventions. It is symptomatic management.
Okay, thank you very much, Doctor. I've got some nursing mothers and pregnant women who want to ask this question. Obviously, study is going on, and we are now encouraging them to take the vaccine. You, even at the end of your slides, you did show that taking the vaccine will help the community a bit. Do you think that is safe for us to do if you're breastfeeding or if you're pregnant? Do you think at this stage in our community, from our background, with all these problems that we have, do you think it's safe for us to get involved in taking the vaccine if we are breastfeeding or pregnant? Oh, is disconnected? So we're trying to get Doctor back. Please bear with us. We're trying to get Doctor back on the. I think he's back now. Hello, Doctor.
Hi, can you hear me?
Oh, yes, we can hear you. We still can't see you. Sorry about that. We hope we'll get the problem fixed.
I'm not sure. I think my camera is connected, so I'm not sure whether it is from my side or from that side.
Yeah, the engineers are trying to sort out what the problem is.
All right, not a problem. So what I wanted to talk about the vaccine, especially in terms of pregnancy, this is one of the things where the UK government has been clear that they don't want it to be mandatory that you need to be taking the vaccine if you're pregnant or you're breastfeeding. So it is still very much a choice that you are going to be making. However, right now the evidence seems to be pointing that because as ethnically diverse, we are considered to be at a slightly higher risk, it would be useful if we can go for the vaccine, because right now the vaccine hasn't shown to be harmful in our group of mothers, pregnant mothers, or breastfeeding. So the suggestion is that please consider the vaccine, because the risk of having problems if you get COVID is much worse than the problems due to the vaccine. This is my understanding, and from talking to a few obstetric colleagues of mine, this is the understanding that I have about vaccines in pregnant or breastfeeding mothers.
Thank you very much. We've got our brother who has joined. He's actually joined us live. He's our co-host. For some reason, he's off for some time. Alex, our brother Alex, he's got some questions to ask as well. So, bro Alex, if you can hear me, can you ask Doctor all the questions that you've got?
Thank you very much, Jessica, and thank you, Doctor, for coming on.
Doctor is back. Bro Alex, can you hear us?
Yes, I can. Can you hear me?
Yeah, I can hear you, Alex.
Okay, yeah. Thank you, Doctor. We appreciate you taking time, to come and enlighten us. I've got a few questions, and I'll try to be quick as possible. So the first one is, about 2 weeks ago, I heard in the news, and it was, like a scaremongering, which is a research that some people have done, and they were saying if someone, has had COVID, they are more likely to have, psychological problems, going forward, post COVID. So after 6 months, there is, some kind of mental issues, if I may say that. Could you please enlighten us on that? So that would be the first question. So COVID and psychiatry, and yeah, you enlighten us on that. And the next one will be, if someone has had COVID and still, he feels well, he's okay, but the cough hasn't gone away. So continuous cough is still there. And what I know is, at the moment, there isn't any medication. Apart from the vaccine, there's no medication that is given to people who are still having this issue. What would this person do? The person is diabetic, and yeah, so that is another one. And then we would like to ask you to enlighten us on vitamin D, which is something that is been very, very important, because all doctors are, especially from where we come from, our background as Africans and Afro-Caribbeans, what I mean, once we leave outside our tropical weather, we have issues with vitamin D. So help us with that, and anything that we could do to help. And then the last
Doctor,
one
can
is,
you hear the question?
Yes,
Can you hear? You can.
because now we've gone to 4 questions there. I'm going to start writing it down. So I've got
Yes, yes,
COVID.
please.
I've got COVID and vitamin D. I've
Yeah.
got COVID with the reasoning. What is the second question that you asked for? You know what? I'll tell you, Alex. I'll go one by one there, and then you
Okay.
have the other 2 questions to start off with. So I'll
No
start from
problem.
the back there. So first of all, the simple ones. So COVID and vitamin D, I would say that it is going to be very useful. I completely understand, and I'm on board with what you're saying. Even in the pain management world, I find that if people are having low vitamin D, they are at higher risk of having fatigue and generalized pain in multiple joints and parts of the body. So I encourage people to get their vitamin D levels tested, and actually to take almost 3,000 to 5,000 units during the winter time, and during the summer time around 1,000 to 3,000 units. And I tell them to get it from a health food shop there. Sometimes if the levels are very low, the GPs themselves will give supplements of vitamin D and calcium. And if it is quite low, they are also giving high doses, 10,000 or 20,000 units to patients, and testing them 2 or 3 months later. So I would say that in the initial phase, when you're trying to prevent from catching COVID, when you're trying to keep your immune system in a better condition, then vitamin D, zinc, vitamin C, other forms of calcium. There are some other supplements like quercetin, niacin. I recommend all this for patients during this period of time of COVID, in order to reduce their chance of getting a severe infection, and to give their immune system the best chance. So that is my opinion regarding vitamin D. In answer to your question regarding the mental health and psychological issues, as I was telling, the problem is that this virus excites the immune system. And the immune system is present in every part of the body. And there is also a suggestion that sometimes small bits of the viral fragments can be there in some part of the brain, and it can just stay there. Like the way, for example, if you get chicken pox when you're young, and your virus, after you get the chicken pox, goes away, but the virus has a nice holiday in some nerves in your spinal cord. And then 20, 30, 40 years later, if your immune system, if your immunity is low for any reason, the virus almost reactivates, and that's when people can get shingles, where you can get a flare up of your symptoms. So similarly, like that, we know that some viruses can hang on in the body for some time. And in this case, if the virus is hanging on in some part of the brain, and the immune system in the brain suddenly becomes overactive, And those parts of the brain are where your emotions are processed, like your mood or your anger or your sadness or happiness is processed, then that can get affected. So I would be thinking that the psychological issues that we talk about, like anxiety or depression, in our number of patients who have come to the long COVID service in Reading, we have had about 50% of patients having anxiety or depression or other psychological issues present 6 or 9 months. And my thought is that, yes, any one of us, we have all gone through such a traumatic time, worrying about our families back in Africa or in India or wherever. So that worry is going to be there, that anxiety is going to be there of just worrying. But for those people who have had COVID, we've got this added problem where the immune system is going to be overactive. And I would be saying that in such people, the anxiety or depression that they have newly been feeling is more due to the immune system being overactive. And I would like to be optimistic that once these things all settle down, that part of the mood also should improve with time.
Thank you very
What
much.
are the other two questions there, Jessica? I've forgotten now.
we struggle to hear ourselves, even the listeners. So if Bra Alex can repeat his question, and
No, it's in the chat.
okay, he's going to text us the question, then we will put it up. We'll put it across.
Fantastic.
But
Okay.
there's another question. So somebody wants that. People are anxious about the vaccine. Somebody is they just want a confirmation. It says, so there's evidence of people from ethnic minority background taking the vaccine with no effects. So my understanding to that question is, so does it mean that it's safe for us to take it? And then I will probably add this question to it. Do you stand a chance of getting a long COVID if you have been vaccinated? So it's like two questions in one.
So right now, all the patients that we have been seeing, we are now in that situation wherein the people are already coming to us. They have caught COVID and are having long COVID, and they are having now the vaccines coming through in the last 2 or 3 months. So we have not seen patients as yet who are getting long COVID despite the vaccine, if you see what I mean. Because to get long COVID, you have to had acute COVID and you are already struggling with symptoms. So we have to first then look at people who get a bad episode of COVID after they have been vaccinated. And then we have to see whether these people will develop long COVID 1 or 2 months after they have had their COVID. Right now, we haven't seen that group of people as yet, because everyone who's coming to the clinic, either they've had one dose of vaccine or they have had no vaccine at all, and their symptoms, their acute COVID has been 6 or 8 or 9 months or even 14 months ago. So I can't say whether long COVID can happen in people who have been vaccinated, not as yet. However, I would be thinking that if you've had the vaccine, your chance of catching a severe infection or a very bad infection is very little. That much we know from the studies, that vaccine prevents you from getting the infection or at least getting a severe infection, which means that your chance of getting long COVID is much, much, much lesser if you've had the vaccine than without. So that is the correlation I would be making. What was the first part of the question, Jessica? So there's evidence of people from ethnic minority taking the vaccine with no effects. For Betty's question there, yes, I would say that we have had a significant number of people who have taken the vaccine, and I'm in touch with a lot of my friends and my family from India, where they have been receiving the vaccine as well, while they have been having this big, massive surge of cases there. And touch wood, up to now, I've got to say that if you've had the vaccine, most of them have not had any side effects. Yes, people are having some side effects after the second dose of some vaccines. However, I would be telling you that the very purpose of the vaccine is to excite your immune system so that it recognizes the actual virus enemy when it arrives. So I would say that if after the second dose or the first dose you felt unwell, that you had shivering and that you had fever and that you had some side effects, I would say that actually it is not a bad thing. It means your immune system is doing the job that it is meant to do. It is protecting you, it is gathering all the armies, and it is mounting a response. And the hope is that when the actual virus may come, it probably will be able to neutralize it, and you may not even realize it has come and gone. And I think that is a way to see the side effects of the vaccine. Yes, there are some people who are getting really bad side effects, like somebody has put about blood clots, and obviously the papers are having that information about some vaccines causing blood clots and other vaccines causing problems. And we have always known, what I would say to that is that every vaccine, whether it is the polio vaccine or the measles vaccine or any vaccine, there is always going to be some small percentage of people who will have an unfortunate reaction. That is like anybody who goes for a surgery or anybody who goes for any chemotherapy for cancer. We know that they are going to have side effects because of the drug or the surgery that is not intended, but it can happen. And with the vaccines as well, that is that small percentage of people, that risk is always going to be there. But when you compare it to the risk of having a acute COVID, I think that risk is worth it in terms of what the benefit is.
Thank you very much. I think we've got Alex's questions, the remaining of his questions. Are there any association between COVID-19 and blood clot, as some people experience breathlessness? However, they did not have COVID, but had blood clot in their lungs. Thank you.
So we are now understanding that COVID-19 is a very strange and a different virus. It's almost like the virus has learned. So the COVID-19 is belonging to a family of viruses called coronavirus. Now, the first one was in 2004. The second group was in 2012. In 2004, it affected about 22 countries. In 2012, it affected about 27 countries. Now, this version of the coronavirus, they seem to have learned a new trick. They are much more effective, and therefore they have affected 220 countries this time around. So they are that 220, probably, I think that's the paper that I read. Maybe it is 186 countries. Who knows? They keep dividing half the time. So we would have to say that these countries, when that effect is shown, the virus is gaining some advantage. I'd like to think of this, and I want to tell you that the virus is not there to, it is accidentally causing us harm because our immune system is recognizing a new virus and wanting to protect us from it. But the virus's only role is to replicate and is to multiply and to find another host. So its job is only to be efficient and finding a way to survive. It also has a survival plan in place. So the better it does and the more effective it does, that's what this COVID-19 has done. And what it seems to do is that it seems to not only affect the lungs in terms of how the air goes from the lung into the blood, it seems to affect the lining of the blood vessels itself, so that it can enter much faster into the bloodstream. And that is causing a problem because the lining, then the blood gets stuck there, and that's where they think that the clots can be happening, that people can have these blood clots, some part of these black areas in the lung, even though they may not have had actual symptoms going on. It's a new thing that we are learning how this virus is doing it. It's a subject of lot of research, and we don't as yet have a drug that can prevent it. And we still haven't got a good enough investigation to say we can find it in everyone correctly and precisely all the time. So it is something we are learning.
Thank you very much. So I would like to add that it means if you want to wait and get the COVID because you feel you don't want the vaccine, your chances of blood clot could be higher. You don't know. We don't know because we are still studying it. So you're better off, if you think you have sound mind, to go for the vaccine, because we've had vaccines for years now, and we still thriving. So that would be the best way to stop the virus, like you're saying. Thank you very much. There's another question. I think we'll pick this question, the last one. We know we've run out of time. From our radio listeners, we always want to get all their questions up because they cannot see us but only hear us. What do people do to reduce their risk of long COVID?
So as I mentioned there, and I think it is almost, this may seem to your listeners like I'm being very stating the obvious in terms of lifestyle. But even with pain management as well, the reason I wrote in my book that it's called the mindset, and I said the mindset is like an acronym. The M is for medications, the I is for any injections, the N is to understand how to manage stress and understand the way the brain processes the immune system and the signals. The D is the nutrition, S is sleep, E is exercise and physical movement, and T is therapies of mind and body. And it's almost like I would say that if you are going to prevent the long COVID, then your chances should be on how do you prevent the acute COVID infection, viral infections. So as we know, for most viruses, there isn't a medicine. So the M part of it, there aren't any medications you can take to prevent the virus. But what you can take as forms of supplements, you can take some vitamin D, some zinc, some vitamin C, calcium, as well as quercetin, niacin. So these are some common supplements that I'm suggesting to patients to keep on to ensure the immune system is as active as it can be. Now, it is still, some of it can be considered slightly controversial in that there is saying how much evidence is there. But my thought is these are at least safe to take. They don't cause any harm, and they are available from your over the counter, from your pharmacy or high street retail shops. So please take them. They don't have any major issues. The injections or interventions, there is nothing of that nature there. But the most important, the end part of it is stress management, because we know that any form of stress that you have is going to activate your inflammation and your immune system. It is going to activate your fight and flight response. So look at how that might be in your daily life in terms of how you can manage stress, whether that is through breathing techniques, whether that is through relaxation techniques, whether that is through family, through connections. Those are all important aspects. Nutrition is something I'm very hugely taken up with. I've done a certification in lifestyle medicine as well, just to study and understand more about nutrition, because that is not something we doctors get taught in medical school itself. So it is something that I've had to almost relearn and re-understand everything. And I would say that it has helped me hugely in pain. It is also helping me with managing the long COVID patients, because understanding what kind of food you eat, when you eat, how much you eat, all of this can have an effect in reducing your inflammation or the inflammatory levels in the body. And that can have a good impact on your nervous and your immune system and strengthen it further. You can actually use nutrition as a very powerful tool to, in a very nice way and a harmless way, improve your immune system. And then we know that sleep, again, 7 to 9 hours of sleep is very important, because it is during this time of sleep that your brain is able to get rid of its waste. That's a time when all the bin men come into your brain and clean out all the rubbish that collects during the daytime there. So it's very important to see how you improve your sleep habits there. Exercise and physical movement, everybody is telling you from every other place there. But what I can tell you is that with good physical movement strategies, doesn't have to be one exercise like regime with Adrian or with Jordan Yo, but it is about trying to make sure that you have a good physical movement strategy that keeps you active, because that builds nerve cells and replenishes your immune system and keeps it strong. And the last is therapies of the mind and body. We used to think that all these things like yoga and relaxation and Tai Chi and Pilates are just techniques that people suggest as complementary therapies. We are now having the evidence to actually say that when you can incorporate connectedness, mindfulness, or meditation, or yoga, or relaxation, or other techniques within, whatever may be suitable within your community for connection and church or religious there, these all have a very powerful effect on the immune system in your brain. They calm them down and they calm the cells down. So that has a very powerful immune protective effect, as we call it. So I would say that all these techniques together can give you the best chance of strengthening your immune system, keeping it as nourished as possible. And all of these are your best bet against the COVID itself, and of course, the vaccine.
Thank you very much, Doctor, for today. We know we've taken your time, but since we want you to come back, please, let me just ask these two questions before we go, and then you can give us some details of how people, our listeners, can contact for help. Someone is asking, do you have therapies to improve the sense of smell and taste post-COVID? And our sister is also asking about the Indian variant now. Is the vaccine helping them? They are taking it, but are you seeing improvement?
So I will answer the Indian one first there. The vaccines are right now being deployed. India, unfortunately, what has happened is the same thing, that there has been that hesitancy of taking the vaccine at the time when it was supposed to be there. Not enough. Obviously, the country has got 1.4 billion people. It is very difficult to have that amount of vaccines to complete everybody to get a vaccine. And then there was a lot of talk going on about hesitancy and this vaccine that works, that vaccine doesn't work, without realizing the importance. Now that they are starting to give the vaccination almost 1 to 2 million a day is the speed at which they are giving, we are hoping that at least future people will be prevented from having an acute infection. It doesn't matter which vaccine it is. They are saying that sometimes the Indian vaccine is very effective against the new strains and the new variants. This is still research that's going on, so I can't comment on it. I think today I saw our health minister was saying that our vaccines are possibly effective against the new variants there. So I think I don't know enough right now to comment on that. But definitely I'm hoping that the vaccination now that is happening in India, I'm hopeful that the overall effect will start to settle and many of the states will start to improve. With regards to the long COVID taste and smell, we are realizing that it is a difficult thing to solve. We are seeing that people's taste and smell are improving. They are improving within 2 to 3 months after the people have had acute COVID. But once it is beyond 6 months or so, we are not having any particular drugs specifically to improve the taste and smell. So there is nothing treatment wise or medication wise that can change it. But what we are very helpful for is in Reading itself. In the University of Reading, there is an excellent associate professor over there. In fact, if you were to go to a podcast, so I had made some podcasts on this long COVID. If you just search on Apple or Spotify for Pain Speak podcast, there is one of the podcast episodes I spoke to a Professor Jane Parker, who is from the University of Reading, and she is the head of the Flavor Center, and she is a trustee of the Absent charity. So this is a charity that is working nationwide, and they actually help people do the smell and taste retraining. It's almost, they will send you materials so that you almost retrain your nervous system to start to smell again. Because what happens in the acute COVID is that the virus goes and affects the nerves that are taking your sensation of smell and taste, and those nerves don't grow back properly or are taking much longer time to grow. So it's almost like if you train them, like you train a child to walk, you can possibly get that smell back. And they are saying that with viral infections, the chances of recovery are higher when you do the smell retraining. So if you just go to Absent Charity, ABSCENT Charity, Absent Charity, and put it in Google, you will come across their work, and you can see some of these kits that you can purchase and try to improve your smell and loss of taste retraining.
Okay, thank you very much. So to confirm, it's Absent Charity. Absent Charities.
ABSCENT.
Okay, CEND. Absent Charities.
Absent, yeah.
Okay, thank you. And also, if you can repeat on your podcast, how we can get on your podcast again to listen, those who are
The name of the
interested.
podcast is Pain Speak, PAIN Speak.
Okay.
And I think if you just put my name and put that either in Apple or in Spotify, you will get the podcast links, and you can see there are about 10 episodes there right now, just looking at long COVID itself. There are chats with my respiratory therapist, with my fatigue therapist, with the GP that I'm working with. And therefore, you can see the kind of service that we are offering within Reading for the communities, for the people of Berkshire. And then there are other people as well who have talked about it, like the Flavor Taste Center, psychological issues. So all of these resources and support is there as audio materials for you to listen to.
Thank you very much. And lastly, your book. Can you give us a title of your book again? And is it on Audible, or can people listen to it, or is it just a hard copy?
I think right now it is there on Kindle and it is there on hard copy. It got released about 2 months ago, so as people can see on the screen, but for those who are listening on the radio, it's called The Pain-Free Mindset. And if you put that on Amazon, you're going to get it there. I'm happy to report that it is considered as an Amazon bestseller, because for the first 4-5 weeks, it was #1 in the Amazon category. And even now, I think when I checked, it's #2 and #4 in the other category. And the only reason it's not #1 is that there is a much more excellent book by Michael Pollan on how to use psychedelics. Now, I can't compare with people who want to use psychedelics. So there you go.
Thank you very much, Doctor. We thank you so much for your time today. We've got lots of our elders on saying thank you to you, and our aunties and moms who listen to us and support us, all saying thank you. We've got Elder Fred Quay standing in for all of them to say thank you very much for all the information you've given to us. Because some of us in our community, we don't really go out and look for the information. Also, for the information to come to us like this is like gold to us. And so if anybody, after listening this evening, want to contact you, can you just share your number or a number that they can contact?
So if they want to go, that's why I was not sure, Jessica, which one to do there. My hospital email address is something that you do have. So I'm happy for the hospital email address to be shared amongst the public there for any events there. And I think that's there. Other than that, really, if they Google my name, there is my website to go to as well. So they can get further ways of contacting me from there.
Right. Okay. So listeners, any question, you can come through our radio lines, and then we will just link you or remind you of the details to get to Doctor. So every information that you need, he'll be able to provide for you. Thank you very much once again. It's been a
Happy to help out. Thank you, Jessica and Kofi and Jacquah, for inviting me. And have a good evening, and stay safe, all of you.
Thank you. Thank you. And you stay safe too. We can say our radio listeners were really listening, and they really engaged. So did our Facebook and YouTube listeners as well. We thank you so much. And we hope that you come back to really share about pain management as well with us sometime. Thank you, Dr. Deepak.
Happy to do that. All right.
Thank
Bye.
you.
Good night.
Have a good night. Bye.